Let's discuss the secrets of best hair transplants today. Also, if you want to find out how you would look after your hair transplant surgery, we'll give you the details in this video only. Let us first discuss one of our patients who had a family history of baldness. His father was grade 7 by the time he was 45 to 50 years of age. But our guy, in his college, he started losing hair. By the time he came to us, he was a professional, but he had lost the hair in a deep temple recession. Also, thinning was there in the front, on the mid-scalp, up to crown. He had used some oils, some shampoos, or some lotions, whoever suggested, and one of his friends was using minoxidil, so he had used minoxidil for a few months. Now we proceeded to very important part of our consultation, which is trichoscopy. On trichoscopy, which is computerized examination of scalp and hair, we found out that the donor area at the back had a diameter of around 0.068 millimeters. It was about 140 centimeters square in area. The density of hair at the back was about 80 follicular units per centimeter square. Coverage value was 11.15, which was decent enough, and we could take out around 4,400 grafts for him comfortably. As we discuss the trichoscopic findings and his long-term planning and treatment, please push the like button so that we are encouraged to give more such educational and testimonial videos for you. When measuring the recipient area, it was around 110 centimeters square. We plan to give him a density of around 32.5 grafts per centimeter square, more on the bald areas and a bit lesser on the areas where he already had some residual hair. So the grafts we put in the recipient area were around 3,600 grafts. Since the number of hairs per follicular unit was more than 2, we had put more than 7,300 hairs for him. The details are seen on the screen. If you have any questions in your mind, you can write in the comment section below. If you want a consultation for yourself or your friend or family, you can call us for consultation on the numbers below. On the day of the procedure, we did sensitivity testing for him. Then we did a hairline marking for him. The hairline was made according to the face of the patient, according to the shape of the face and the forehead. The forehead was a bit broad from the very beginning, so we made a hairline according to that. The mid-frontal point was kept at around 7.5 centimeter. Also, hairline was a bit irregular because natural hairlines, you will not see a very regular hairline. When we make the hairline, we make it sure that naturalness of hairline remains. The pattern in which the hair grows is very natural and good looking. Slit making was done with sapphire blades. Graft harvesting was done after that, and graft insertion was done with implanters with state-of-the-art tools and equipments. Patient went back to work after his hair transplant surgery, and now he has come after 7 months. You can see the change in the structure of his hairline, the frame of face he has now got, and the hair he has now to comb. We can still feel a number of spicules by which we know that some new hair are yet to come. He has now come at 10 months, and you can see great growth of hair there, a very good frontotemporal angle which very nicely mingles with the rest of the hair. You can see his donor side picture and combing video at 10 months. Nobody can say from where we took the grafts. It looks so natural, both at the donor side and in the front. Please subscribe to this channel so that you get more of such educational and testimonial videos. If you want to see how you will look after your hair transplant, you can take the help of Saraswat Hospital Peak AI app and follow these very simple 3 steps. Download the app, take the quiz, upload your pictures. You will get your results in 24 to 48 hours because the ABHRS doctors would actually see your pictures and give their suggestions. Also, you will have 2 more benefits. Number 1, you will get to know how many approximate grafts would be needed by you for hair transplant surgery. Also, when you go to consult with your doctor, what right questions you should ask your doctor so that you understand what your treatment plan would be. So what is the take-home message of today's video? If you want to get a good hair transplant for you, first of all, you can find out how you would look with the PKI app of Saraswat Hospital. Secondly, always see for consultation, always look out for consultation with an experienced hair transplant doctor. Please look out for credentials of your doctor. Then you should understand long-term treatment planning for yourself. Most useful thing would be trichoscopy when done for you so that you know the condition of your donor site as well as how much recipient site would be required, how many grafts would be required, and so also want. Then the latest tools and technology should be there for you. Then aftercare should be very good. Hand-holding by the team for you should always be there. If you want to know about cost of hair transplant, please click the video on the left. If you want to watch a new hair transplant video, please click the video on the right.